You are listening to CrossTalk, a safe place to discuss addiction, recovery, harm reduction, and everything in between. Support for this podcast comes from the Kentucky Opioid Response Effort and Advocates of Recovery. Content and production by the team at Turning Point Recovery Community Center. Now, buckle up and get ready for the show.
Welcome everyone to CrossTalk Recovery, the recovery podcast that supports all forms of recovery. I'm Matt Lewis, and I'm here with
Cody Lynn.
Matthew Dacus, Area Manager for Spero Health.
Lori Stratman, Counselor at Spero Health.
Welcome you all. I'm glad to have you on here. We wanted to have you guys on today, man, because of the importance, I think, and to destigmatize, medically assisted treatment. We have several of our clients at Turning Point that either are in your guys' program or in other programs like that, outpatient programs in the area, and I've seen a lot of success with that, especially like Cody. He's a great success story of it. I had a lot of friends when I was in the madness that were on it, and it helps them. You're able to live a normal life. You're able to work, and you don't have to worry about the getting sick or the scrounging for money and all the things that people struggle with when they're using and getting in trouble with the law and stuff like that. So I believe that it's extremely beneficial, and we wanted to just have you guys on and talk a little bit about your program over there at Spero Health and outpatient treatment in the area in general and the benefits of it, and to try to crush some of the myths and the stigma that surrounds that. So Matt, why don't you tell us a little bit about your guys' program? And
Sure. Basically, we do outpatient addiction treatment. We can specialize in opiate use disorder, but we also can treat pretty much every type of addiction there is. We offer groups for stimulant addiction. We offer Vivitrol therapy for people with alcohol use disorder. And we even treat smoking cessation if somebody wants to quit smoking cigarettes. But as far as our program goes, it's a basic, pretty standard outpatient program that does offer MAT for people with opiate use disorder. I'd say we specialize in that. And we have several types of resources that we offer along with our program. I think people tend to get the misconception a lot that when people go to a place that does MAT, they refer to it as like a Suboxone clinic. They go to a Suboxone clinic. Oh, they go to the Suboxone clinic. And what they don't realize is that almost every outpatient treatment facility that does MAT, especially that are CARF certified, where they do their certification through CARF, or accreditation, sorry, they're required to meet certain criteria in order to operate, in the state in compliance with our accreditation. And in doing so, we have to offer several things that a lot of people may not know that we offer that go with our program, which includes counseling services. And in our program, counseling services are mandatory for compliance with the program. We also have optional services like case management services. We have peer support services, people who have been through the addiction process and can help kind of guide people through the process themselves. And we even have, our medical providers that do the medication prescribing. And it's not just, like I said, it's not just Suboxone. We do, Vivitrol injections. We can do the Sublocade injections for people that don't want to take the actual medication every day. And on top of that, we offer smoking cessation. We do, groups specifically tailored toward stimulant addiction, specifically methamphetamine for the most part. And as far as your standard outpatient experience with our facility, I'll kind of give a base overview, and I'll kind of let Lori dig a little deeper into the heart of what we do at Spero. Is we mainly focus on the counseling aspect of recovery. So with our program, basically we do new patient assessments. The new patient assessment, a patient will call, and we have a rule: we get them in with 24 to 48 hours. We call it same day, next day. We attempt to get them in actually as quickly as we possibly can for the most part. We find that sometimes people change their minds in a very, very short amount of time, and we have a pretty limited window when someone calls and asks for help. And we find that if we get them in quicker, they're more likely to stay with us longer, and we're more likely to make a positive impact on the patients. In doing so, the patient will come in for an assessment. Lori will dig into this here in a minute and kind of all the breakdown of that. But after that, they'll review them to see if they need case management services, anything like that, and then they'll go to our medical provider and they'll do what is it, the Cajun cows? They do
Cajun cows to evaluate withdrawals and how appropriate they are for medication.
And using that, the providers will usually, decide whether or not they fit the model for opioid use disorder or any type of other addiction treatment that requires medication. And in doing so, they tailor kind of a dose for that person based on the severity of their addiction, how they rate on several different medical evaluation parts of the actual medical evaluation. And in doing so, after that, we schedule their appointments. Most patients, I would say predominantly the largest degree of our patients start off at phase 1. We're technically a 3-phase program. The first one is called induction. And in that case, our patients will come in weekly, usually do weekly visits with us for an extended period of time. And like I said, Lori will talk more about the individualized patient care portion. But in terms of a broad overview, we'll have phase 1, and they do a clinical review process for our patients and kind of review things with them. And if we feel they're doing well enough and stable enough to move to phase 2, phase 2 comes every 2 weeks, and it has not a hard and fast set of rules, but I guess you'd say like kind of things they're looking for to make sure they're stable enough to go to the next step. And then we'll get them out to usually a monthly phase, where they'll come once a month, do their counseling once a month, and counseling and provider visits are usually paired up with every single visit to make sure they're progressing through treatment. But then eventually we want them to be on the lowest dose of medication possible if they are on medication. Sometimes that means they're completely off the medication. Sometimes that means they're on an extremely low dose sometimes. But like I said, there's no real set time frame for it. Basically, it's individually tailored for each person's recovery. There's no hard and fast rules for how long it's supposed to take someone to get through the program. Each person is kind of judged on how quickly they're capable of doing it.
Basically, the one thing that we focus on is the whole person, and so we don't look at just your drug use. Your lifestyle affects your addiction recovery. Your addiction recovery affects your lifestyle, so we want to look at more than just your using. We look at your living environment. We look at your mental health, your emotional health, your physical health, and all those life skills. And a lot of times, it's hard for counseling to get anywhere with someone struggling with addiction when maybe they're coming into treatment and they got so low that they are homeless, they don't have any family anymore, they've burned all their bridges, so they don't have any of their basic needs being met. We can't work on their emotions or building up coping skills when they are more focused on finding food and shelter. So we look at the whole person, and that's where our case management and peer support come in handy. So we have case management that helps them find needs that they need to be able to cover their basic needs and their safety and security. And then we have counseling and peer support that covers the other areas. And we focus on the individual. So we tailor each patient's treatment to their individual needs. Some patients start off on a very low dose. Some patients start off on a moderate dose on their medication. Some patients will start off with individuals only for a while to focus on getting them more stable so that they are able to handle groups. Some people go right into groups. Some people will come weekly longer than others, and it's based on the individual needs. And that's what we focus on, is the person, not the patient. We look for little progresses and focus on success regardless of where they are in their addiction.
I think I talked with Lori about this earlier today. We actually had a discussion about this. It was kind of debunking the people aren't making progress in recovery. Well, they still have an illicit problem they're dealing with. And a lot of the times we'll have patients come into our program that are on 4 or 5 different illicit substances. And we'll, within a few months, have them down to just 1. And just reminding people from outside that scope that's a big deal.
It is.
It's a huge deal to stop anything, and especially if you're stopping 3, and we're still working on 1 hurdle. And that's a mountain of progress that we gotten through some patients. And basically, we talked about that earlier because I had the same discussion with just a random person, one of my friends in my friend group, about what was it like working with the patient population, and well, how do you think that's recovery, and this kind of stuff. I mean, it really takes a lot to just speak to people about it sometimes because they just don't know. There's not a lot of education on the subject.
We'll be right back.
Hello, everybody. You want to know something? My biggest issue with meetings is, despite their name, they're never about me. Here at Turning Point, all of our meetings are for you and about you. We have meetings at least 3 times a day, 7 days a week. We are located at 415 Broadway, Paducah, Kentucky. Call 270-444-3621 for more information.
Did you know that recovery from substance use disorder and mental health go hand in hand? That is why the caring and compassionate mental health professionals at Four Rivers Behavioral Health in Paducah are here to help you find your balance. They are proud of you for making the changes necessary to live a healthier life and would love to see you reach your full potential. Give them a call at 270-442-7121 or stop by the downtown location at 425 Broadway in Paducah, Kentucky.
You get somebody that walks in the door and they've lost everything, and so not only are they dealing with all the consequences from their lifestyle when they were using, they're dealing with trying to get their life back in order, plus they're dealing with everyday typical things that we all deal with. So you're dealing with so much that it's too much to expect them to be able to stop using everything right on day one. So we just tell them, okay, let's focus on first, if it's someone with opiates and other substances, let's focus first on getting you off of all opiates, stabilizing you on the Suboxone. Then we'll focus on the next substance, and we'll focus on it one thing at a time. And once they start seeing success with, I'm doing great on not using opiates, okay. I'm only down to this. It gives them more motivation and builds up their confidence when majority of the times they have no confidence when they're coming in.
Right. Yeah, I completely agree with a lot of things you guys are saying. Like, I think it's really important to realize to treat the person like everybody's different. Everybody's been through different experiences, whether it be trauma or whatever people have been through. You got to figure out where they're at, mentally, physically, all those things, and that's a great way to approach it. And also, I didn't know, like, Matt, what you said about getting to them early. You have that small window. I didn't know that that was a thing for you guys, and I think that's great because that's kind of like the best time to help someone get into treatment or to be willing to start a recovery journey is, like, sadly after an overdose or something, and like you said, people coming in, homeless, broken. It's sad that it takes getting to that point to being willing to do something, but that's when it's the most crucial to try and get to those people because that's when they're open and willing,
We've had patients walk in with maybe a family member or friend who's in the program and they're struggling, and we didn't have spots available, but we figured out a way to revamp a schedule or borrow a clinician from another clinic, and we got them scheduled for an assessment either right then or the next day, and they come back. But a lot of times what we find out is, and I've had patients that tell me this, where they've called, they've made an appointment, their intake is a week later, and before their appointment comes, they've relapsed and got off the deep end again, so now they're not in the right mindset. Or they're homeless and they have no way to get here. Or they don't know what day of the week it is. So that's too long of a window to try to get somebody in. When they say, I need help, they're wanting it right now.
And something they remind us of, too, and in those instances where we have nothing and say they call it 4:30 in the afternoon and we're talking to somebody about needing to get in, of course we're going to get them in as soon as we can the next day. But I've just sat and talked to people for 20, 30 minutes on the phone just to hear them out and let them know what's going on, that we care and we're there to help them, and we have something available for them first thing in the morning. Just come in. And a lot of the times, too, if someone's in crisis, I mean, I'm not a counselor by any stretch of the means, but I'm a willing ear to listen to someone if they have some issues. And it just a lot of times they just want to be heard and just be able to discuss something and they're not alone. And we encourage that environment in our clinics, and I think every place that does outpatient treatment should. We've had instances of patients that just come in and we'll say, hey, can I sit in the lobby for a little while? There's people using it in my apartment and I don't want to be over there. Yeah. And I'm just like, sure. Hey, you want something to drink? You want some water? Yeah, just go out and have a seat. And they'll sit in the lobby for a couple hours and then get up and leave. And to know that, they have like a safe space like that, it's just, it just makes me feel really good about, the work that we do and stuff. But like she said, the main thing that keeps me up at night with a lot of the, like you said, getting them in the same day and next day is what happens, and what constantly goes through my mind and pretty much my entire team is, if we don't get them tonight, is there a chance that someone could overdose?
Yeah.
And they're obviously going through a rough enough time where they are desperate enough to call for help and ask for help. And if we're not there to answer that call, that could be, catastrophic to someone trying to get into recovery.
For a lot of them, when they ask us for help, they're honestly not necessarily expecting us to actually help them. A lot of them have asked for help multiple times, and they're met with a lot of disappointments along the way. You gotta wait, or well, it's your fault, or we can't help you. They're really low, and it takes a lot of courage for the majority of them to even call to make an appointment, let alone wait to come in. So yeah, we want to try to get them in as quick as possible. We want to make sure to treat them as a real person,
and that's,
because most of the time they're not.
Yeah. And when I initially got into this field, I worked in senior care before I got into addiction treatment. So this is a completely new ballpark for me when I got into it. And I remember it was like the first couple weeks that I was there, just like realizing that I had no idea that there was such a large portion of people dealing with the stuff that people were dealing with. And it completely changed my thinking on everything. I kind of had no idea what I was getting into, but at the same time, like, I was like, I have to do something. Like, this is, and trying to educate people on it too. And like I said, it just kind of blew me away. Like it does most people. I guess that start off in the field or people that don't have a history with it.
Yeah, if you don't know about it or haven't experienced it, you don't realize how big of a problem it really is.
And unless you've walked in their shoes, it's really hard to understand what they've been through. I'm very passionate about this field. This is probably the only field I'll work in. And I love the company I work for. Spero Health, I feel like our team here in Paducah does an amazing job. We have multiple locations, but there are also other very qualified MAT or addiction outpatient treatment programs in the area. So if anybody watching this is needing somewhere to go, please come up to Turning Point, ask for references, call somewhere, get in somewhere.
Like,
absolutely.
Like I said, like I would love for people to come see us, but at the same time, I've helped people find places if our scheduling didn't fit their needs, or
right.
I have no problem, referring people to other facilities, because as long as they're getting help, that's the end. That's what I care about.
Sometimes our program's not the right program. Sometimes we're not the right fit, and that's okay. There is a program out there that is the right fit. Keep trying.
Mm-hmm.
Yeah, and I love to hear that you said that people come in and hang out there and because they see it's a safe space and stuff, because that's literally what Turning Point is about, to provide that safe space for people to come hang out when they don't have anywhere positive for them to go at the time. So I'm glad that that's going on there too.
I had a patient several years back, and he kept relapsing because of his living environment. And it's not that who he was living with was using, it's just the people around.
Right.
And sometimes he might get in an argument with the person he was living with and need to leave. Well, the only place he could leave was where drugs were. So I said, if we're open, come here, come hang out, ask for a soda, hang out in the waiting room. The only thing I gotta tell you is when we gotta close, I'm sorry, I gotta make you go. But they, at that time, that was before you guys opened up here, if I'm correct. And, so there wasn't a whole lot of places. You got the library. That's the only thing I could think of.
Yeah.
and whatnot. So now, we still tell people they can come hang out in our place if they want. I got some of those cards from Turning Point, and I'm also recommending people come here as well, because it's nice to have somewhere safe where you feel comfortable going.
We'll be right back.
Hey y'all, did you know it's illegal to own just one guinea pig in Switzerland because they get lonely? Here at Turning Point, we don't want you to ever be lonely either. That's why we are open 7 days a week from 8 a.m. to 8 p.m. Always feel free to come hang with our friendly staff, and don't forget your guinea pig. We're located at 415 Broadway Street, downtown Paducah.
One thing I have always wondered is who put the alphabet in alphabetical order. At Turning Point, our goal is to help you put your life back in order. If you struggle or have struggled with substance use disorder and are in need of help, come see us at 415 Broadway Street, Paducah, Kentucky, or call 270-444-3621 and sign up for peer support services with one of our friendly staff who have lived experience with addiction. Hope to see you soon. We're all working together. I pull for unity in the recovery community all the time. Like, we're trying to save lives. That's the primary purpose. And, I relate to what you said, Matt, about, you're not a counselor. I'm not a counselor. I'm a peer support. Like, I have lived experience in addiction, but, working as a peer support and doing one-on-ones, people just want to open up to you. They look at you sometimes as a therapist, and I can't give them all the answers, but like you said, sometimes just listening is enough, and I think that's an important part of I try to be as empathetic as I can towards people. I'm definitely sympathetic to everyone's situation, and just being able to listen and try to relate to them on whatever level you can, and give your experience, strength, and hope to them is an important part of what we do, and sounds like what you guys do too. Cody, you were on a recent podcast, the Drug Court podcast, and you are open about your, being an MAT, and you're a great success story for it, man. I've seen, when I first seen you come in here, quiet, shy, didn't know if you wanted this or not yet, drug court, being forced to do it. Nobody likes drug court in the beginning. But there's been extreme growth in you, and I'm proud of you for that,
Thanks.
And a lot of it's been through, you're doing medically assisted treatment, and then you work in the steps and coming to peer support. So talk a little bit about your experience with it, man.
Well, Spero Health, I've been going to them for a while now, and they were there for me in the rough part of my addiction too, and they were definitely there whenever I decided to change my life and start my recovery. Suboxone for me, it helped stabilize me in the beginning part of my recovery, and it helped take the phenomenon of craving away from me. Just knowing, I'm phase 3 y'all's program now, and I'm tapering down now, so I'm doing pretty well.
Yeah, I know you are, man.
Yes,
I
sir.
said, I'm proud of you. And that, I really do like the tapering down part of it, man. Sometimes I know there's a lot of stigma and myths attached to, MAT, but and that's the one thing I always say is sometimes I wish there was more incentive to wean off of it, to taper down, and I think there is becoming that more and more, and I'm happy to see that.
The thing to do with it, too, is that to do it in a controlled way. I think that a lot of people may not know how it works, too, so... So as far as, the tapering, we like to taper people in pretty incrementally small doses to where you're not having physiological side effects from the tapering process. And if we can avoid as many of those as possible, it makes the tapering process much easier on the patients. And plus, it's paired with, it's never like, hey, all right, you're going to taper down, we're going to cut you down on your meds right now. It's, hey, we're going to discuss this in the future. They have a meeting with their counselors like Lori, and Lori delves into, deep aspects of this is something you might experience during the tapering process. I want to get you ready for it. Is there anything you're concerned about doing this before we do this? Because we want to make sure it's going to be successful. And having the preparation and to do so, I think, also just makes it exceedingly easier for people to deal with.
I've been with Spero for 6 years. I started as a case manager and then became a counselor. And one thing that I've learned is the biggest hurdle with tapering is the fear of tapering.
Sure.
Someone who's struggled with addiction for as long as the majority of our patients have, now they finally have success. They have a job, they've got their relationships back, they've got money in their pockets, they're sober. Why do I want to take away the one thing that's keeping me there? So there's that huge fear of what happens if that a lot of them struggle with. And the way I look at it is, I don't know about other programs. I know about the way ours works. Our counselors and our providers, we work very closely together. So if a provider notices that one of her patients has some fear or hesitation associated with tapering, she's going to have them scheduled for an individual to discuss that with the counselor. I talk to every one of my patients, and I'll do this in group. We'll talk about, tapering. And I use the word tapering quite often to try to take the fear of the word away. But I use cognitive strategies, because basically the way I explain it to patients is the doctor works on getting your body ready to taper. But if your brain's not ready to taper, it don't matter how well your body is. So my job as the counselor is get your brain ready to taper. And a lot of times that's what people forget, is to get the brain ready. So we focus on helping patients be okay with tapering, to let them know that they can do it.
Yeah. And I think that coupled with the, therapy sessions that you do, and, like I know Cody works the programs, working the steps, you build those connections in the community around you of support also, that, if you're using them properly, you go to them when you're struggling with things. And then, like, I know if it's not working, you guys can up the dosage again and, till they're ready. But I think that all those things working together is what makes it work for people,
Yeah.
That's why it worked for me.
Absolutely.
That's the big thing that I just hope to get out of sharing this stuff too, is that it's not just medication, it's not just counseling. It's a holistic approach to treating somebody. We try to cover every aspect that can be negatively affected by addiction, and make sure we can cover everything we possibly can.
Whatever we don't offer in-house, we refer out. We will touch on mild mental health issues that patients are handling, but typically me and our other counselor, we prefer to refer out for mental health treatment so that we can focus on addiction and their other therapists can focus on mental health, because it's hard to focus on both at the same time. So if we do it that way, it works better. So we refer out for mental health. We refer out for dentists, for all different kinds of other resources that they might need. Vocational rehab, we've referred out for that.
Yeah, that's great. I mean, that's kind of how we do it. We refer to Four Rivers for mental health and therapy and stuff like that, because, like I said, we're not therapists. But I feel like that's a really great model, man, because it takes a city or a village, as the saying goes. We can't do this alone. I mean, I know that I couldn't have done it alone. It was, when I got to treatment, it was seeing that there was other people that were trying to do it seriously, realizing that there was help, and then being willing, to apply myself and put the action in. And I really think that, thank God that you guys are a part of the community that's helping to do that, because I think you guys are doing a great job, and I've seen the success, in that. So I really appreciate you guys. Is there anything else you guys want to say or talk about before we close this out?
I'm good.
Just that, I guess if anybody is on the fence about going into recovery and you're concerned about confidentiality or anything like that, just know that, and I don't think most people know this, but substance abuse treatment and mental health treatment falls into a separate category of HIPAA that is a lot more
Oh, yeah.
stringent in getting any information out there. So confidentiality is fiercely protected at pretty much any place that you go to for any kind of treatment. So if you're concerned about confidentiality or anything like that, it's not something that I would be very concerned about. I know I myself have dealt with it repeatedly with several different aspects of
the punishment for breaking HIPAA is pretty severe too, so that keeps you in check.
Very severe, and I always say I stringently and ardently protect our patients' privacy, and that's one thing that I think a lot of people are hesitant about coming forward because they might not ever let anybody know that they even have an addiction problem, and they may be afraid to actually admit it or talk to anybody about it. But just knowing that stuff's confidential, and people like me in the operations aspect will fight tooth and nail to keep anything that you say or do there pretty much confidential. And I want people to feel like they're open to talk about things.
Yeah, and that's why I feel like it's so important to do things like this, to break the stigma, to get the information out there, for people like Cody to be, to come forward and be proud of it, and other people be able to say, look at how this is working, and be proud of him. Yeah, we need more of that, because to break down those barriers of fear and that people might have,
Yeah, and I want to point out, Suboxone is not replacing their drug. We teach patients how to take it like a medication, to take it exactly as prescribed, take it properly. Basically, I want my patients to treat it like they would their blood pressure medication or diabetes medication. If you don't take your blood pressure medication or diabetes medication, it's going to affect your moods, it's going to affect your mind, it's going to affect your body, just like regular drugs do. So it's not a drug necessarily. It is a medication, and it helps patients. They're not getting high off of it. They're preventing themselves from feeling physical withdrawals. And that's super important because those physical withdrawals are extremely painful. So a lot of times people will come, or people keep using opiates just to not feel that.
Yeah, absolutely. Well, once again, thank you guys for all that you do. Thank you for providing the information, for helping get it out there, and for coming on here and talk about it. Thank you, Cody, for being willing to do this. Check us out on YouTube, or listen to our audio versions on Apple, Google, Spotify, or Podbean. And as always, stay grateful.
If you or someone you know is struggling with addiction or in recovery and needs guidance, speak with Turning Point's team of peer support specialists by calling 270-444-3621. You are not alone, and we are proof that recovery is possible.